Thanks for joining us here on 9 News Watch. I'm Chris Bianchi, and in a few moments we're going to have a press conference from Governor Polis, who will be giving an update on the state's COVID response. Now, a couple things to potentially watch out for. One, we've noted some increasing, concerning trend overall in terms of those hospitalizations as well as case numbers. We have seen those steadily climbing. It does not appear, according to 9 News Director of Reporting, Chris Vanderveen, who keeps very close tabs on this. It does not appear at this point that we have reached a crest. So we continue to see those hospitalization as well as case numbers continuing to climb in the state. In fact, Colorado now at 676 people hospitalized. I can't spit that out, from COVID statewide. That is an increase of nearly 100 people from this time a week ago. So again, noting those increases. A couple things to watch out for, as I mentioned. Will there be any new measures implemented? Right now, statewide employees are not mandated to get vaccinated, not all of them at least. There are certain subsects, corrections, nursing homes, but not all statewide employees are currently mandated to be vaccinated. Right now, if you are unvaccinated, you are subject to twice-a-week tests. But now with the FDA full approval, we may see some possible upping here of those mandates, at least from in terms of statewide employees. That's another thing to watch for. But at this point, Governor Polis has been pretty hands-off when it comes to implementing some of those mandates, especially since the emergency declaration was lifted a few months ago. So again, just speculating a little bit here. Will we see any new measures statewide implemented? It's another thing to potentially watch for, especially again with a lot of kids going back to school. What are we going to see with that? We've seen a lot of contentious school board meetings. Are we going to see some sort of either verbal mentions or possibly, again, some of those mandates? Again, we're going to have to see for that over the course of the next few minutes. But again, at this point, we're not seeing that crest in those cases. According to Chris Vanderveen, that likely means that case count will continue to climb. We could be looking at perhaps the second highest peak for statewide COVID cases in the next few weeks. So obviously the COVID situation here across the state of Colorado, it's not great. It's certainly not as bad as places like Louisiana or Florida or Texas. A lot of the southern states have been grappling with the Delta variant over the last few weeks and seeing those exceptionally high case counts. Colorado's not at that point, but unfortunately the trend at this point, we are still seeing that upward tick in those overall case counts as well as hospitalizations. So we'll see what the state is going to do about it, if anything, or maybe just getting some recommendations about getting vaccinated. Again, we'll find out over the course of the next few minutes. But again, Governor Polis is set to give an update on the statewide COVID response in the next few months. So stay tuned right here on 9 News Watch.
Colorado,
Recording
be
in
careful,
progress.
wear a mask around others, avoid large gatherings indoors, and especially get vaccinated if you haven't. This is still largely a pandemic of the unvaccinated. If you are vaccinated, people can contract it, but the cases are much more minor. So please get protected. You don't want to be one of the folks that regrets not getting protected from a hospital bed or, God forbid, losing a loved one. Hospitalizations is up by 4 at 680. So we've yet to see a change in the trend of hospitalizations. We don't yet know enough to know if there's a slowing of the trend, but I would also indicate that we are not near exceeding our hospital capacity, and we remain fully capable of serving any Coloradan who needs healthcare, regardless of whether that need is COVID-related or not. This morning, I met with Jeff Zients, who's in Colorado to meet with the National Governors Association, which we're hosting several governors from other parts of the country here in Colorado today, talking about COVID, the economic response. And really, it was a good meeting. We got to introduce Jeff Zients, who's the Biden administration's point person on COVID, to our state response team. You've heard from many of them on these press briefings. Dr. Hurley, he joined us, Scott Bookman, Director of Public Safety, Stan Hilke, my Chief of Staff, Dr. Eric France, a few others. Really, so first of all, he could learn firsthand about a state response. And as he indicated to us, one of the more successful state responses, as you know, we have the 10th lowest death rate per capita, and we are among the states with a higher than average vaccination rate, especially considering the large nature of our state. Some of the smaller northeastern states are doing even better than us, but for a large, diverse state, we are one of the top states for vaccination, and overall we're in the top 15 or so, and have been top 15 or 20, 10, depending on where we're at. So very encouraging of our response. It was great to have him meet with our team, and great for him to hear from us. We really raised 2 main items with him. It was great to hear input from across the board. One is we are big fans of and use, and across many ways, the instant testing, the Binax testing. So currently that is not allowable for FEMA reimbursement. They reimburse, in effect, the more costly test that we also do, but that is a less expensive test. That is a very convenient test, and we requested, as we have in the past, but now elevated to him, that they look at FEMA officially sanctioning the use of the Abbott Binax instant test. Secondly, we talked to him about the campaign boosters, the vaccine boosters, the campaign for the vaccine boosters. Specifically, we were somewhat concerned with initial reports out of the federal government that indicated that there had to be an 8-month period before the second doses. We talked about how when we do especially our equity and outreach clinics and others, we want to give people a window of time to get it. We suggested a 60-day window. That would mean 6 months to 10 months. Of course, any Coloradan could now get it. If you attest that you have an immune deficiency, you can simply get it at a local pharmacy and attest to that. But for the broader public, getting the booster, which has shown great results in terms of reducing COVID rates, we requested that there be a 60-day window on that 8-month period. He responded, he was very interested in hearing about why we needed that. Then the news broke after we met, about an hour or two through a break in the Wall Street Journal, that the federal government is actually looking at a 6-month period, which we support, we favor, we think that's good. Not directly, I can't take credit for that as the outcome of my meeting with Jeff Zients. He was as surprised as me that had come out. That was not how they intended it to come out. At this point, it is a leak. We don't know for sure if it's reliable, but that is the kind of news we would like to see, because frankly, as we go to different communities, we want to cast a wide as net as possible. Whether you're at it 6 months ago or 8 months ago or 9 months ago, we want folks to be able to get vaccinated, particularly in our hard to reach communities who need the booster the most. The folks who really want it can go to a pharmacy and get it now, and will be able to get it. But as you know, one of the reasons we've been so successful in having one of the higher vaccination rates of the states, and therefore one of the lower COVID hospitalization and death rates, is because we're really going that extra mile to meet people where they are. And it will be the same with the booster campaign as it was with the initial first 2 doses. We're also beginning to get information on the path forward for those who received Johnson & Johnson, somewhere around 3% of our state, and what the booster might look like for them. That information is not yet finalized, but we're hopeful that we will have that soon. It is, of course, finalized for Pfizer and Moderna. You should get the 3rd booster shot of the same vaccine that you got for the first 2. With that, we'll open it up for questions. Go ahead. Hello?
I'm sorry, I wasn't prepared to be first in line. Can you say more about the Binax testing? I've seen some reports that there's been a delay in negotiating contracts for those and making them available to schools. And I was wondering if we could get an update on that.
I'm not aware of any delay. We have sufficient testing now for schools. They will be under a new contract in early September. We expect that Binax will be a big part of that. My comments to Jeff Zients about Binax were not related to the school testing campaign that is fully funded by a separate federal funding source. They were related to the non-school use of Binax and how those are reimbursed effectively, whether we have to use state emergency funds, which are limited, or whether we're able to submit those for FEMA reimbursement. I was advocating allowing federal reimbursement of non-school Binax testing in the same way they already reimburse the more expensive testing that we do through contract, but it does not affect the school testing program. There's a separate funding source, over $150 million for that specific purpose, and that is on track. Next question.
Next question is from Lori. Go ahead, Lori.
I'm guessing that's me. So this is a non-COVID question, but in June of 2020, you talked about a lack of public confidence in the process of evaluating what happened to Elijah McClain. You assigned the Attorney General to handle an investigation, but it's been more than a year since that happened, and we've seen no outcome from the Attorney General's office on their patterns and practices investigation into the Aurora Police Department, and still nothing from the Health Department's ketamine review, which was announced more than a year ago as well. As we approach the 2-year anniversary of McClain's death, what do these long delays do for public confidence in this investigation?
Well, look, first of all, Elijah McClain was a gentle soul, especially loved for helping others, his giving spirit. And of course, I can't imagine the grief that his family continues to go through today, tomorrow, every day, with the tragic loss of Elijah. And I really extend my deepest sympathies to the family, especially Elijah's mother, friends. We, of course, want to take every step we can to foster public trust and confidence. That includes making sure that any independent investigations and work occur on their own timetable and not with artificial deadlines of having to meet the timetable we might want them to reach. They need to be thorough. They need to inspire public confidence. I'm confident that the process is in place to do so with a special prosecutor. These are decisions that need to be well done rather than done too quickly. Next question.
Next question is from Meg. Meg, go ahead.
Hello, this is Meg Wingeter from the Denver Post. Can you hear me all right?
Yes, please go ahead, Meg.
Okay. You said about, you've asked people to be careful. Are you considering any state level actions if the hospitalization trajectory doesn't start to turn around in the near future?
Well, I began my remarks by indicating that our hospital capacity is not currently in jeopardy. We have about 680 people hospitalized. We're able to serve those in need. There are states that have reached or exceeded their medical capacity. Those states generally have lower vaccination rates than us. And, at this point, it's really important that Coloradans show the individual responsibility to keep themselves safe. And that's first and foremost, if they're not fully vaccinated, getting vaccinated. If they need a booster, getting a booster. But also, whether they're vaccinated or not, being careful, limiting large gatherings indoors, wearing a mask when you're around others. Those are all smart steps to take and steps that will help Colorado recover faster. And it really is due to the people of Colorado that we have been more fortunate than many others in a lower death rate than many other states in this pandemic, and a lower relative incidence now in the bottom 10 states with regard to the current levels of COVID-19 in our state.
Thank you.
Next question is from Stephanie. Stephanie, go ahead.
Good afternoon. This is Stephanie Rodriguez with Telemundo Denver, and I'll be asking my question in Spanish. Gobernador, ¿qué planea o qué plan tiene para ayudar a que la historia del año pasado no se repita en las escuelas, ya que son 2 escuelas que han reportado que regresan a clases remotos, en parte algunos días, por el brote de contagios? ¿Tiene algún plan o qué planea hacer al nivel estatal?
Es importante tener cuidado en las escuelas. Yo tengo 2 hijos de edades 9 y 7 y ellos están usando tapabocas cada día. en algunas escuelas es requerido, pero también en algunos yo sé que no es requerido, pero es el decisión mejor para sus niños y sus hijos. Y por esas razones mis hijos siempre usan tapabocas y lo mejor cosa que puedo decir a gente quien preocupas por sus niños y ellos son más protegidos con tapabocas.
Thank you. Jaleesa, you are next. Go ahead.
I don't know if this is a question for the governor or for CDPHE, but will the state be getting more of those Bionex test kits for non-school use? If so, do we know when? I know there's a shortage across the country, and there's a New York Times report that Bionex destroyed some supply when demand wasn't there. But it appears if you want to apply for those at-home kits that CDPHE supplies for those front-facing workers, you currently can't order them. So just wondering if we are going to get more.
We have a variety of testing, as we indicated. So those are one test. There are other instant tests, and of course, there are tests that take 24 hours or 48 hours also available. So there's not any one test that we rely on to the exclusion of others. The Bionex tests in particular are very useful. Our main comment to Jeff Science is we hope that they can be included as other tests are. They're currently excluded from FEMA reimbursement. That would allow the state to purchase more for non-school use. But we currently have many of them in state. They are available and they are used in many settings as we speak, including, for instance, for our prison guards in Colorado who test regularly to avoid the spread of COVID to our incarcerated population.
Karina, you were next. Go ahead.
Hi, Governor. This is Karina from the Aurora Sentinel. So regarding the local control over public health orders, given the latest developments in Adams and Douglas County, with both those counties opting out of the mask order for schools that was imposed by Troy County, and I guess, are you still confident in your support of local decision making?
Well, I think that our local public health authorities are in the best situation to assess the needs on the ground to ensure that schools remain in person, which is certainly our overriding goal. In addition to hospital capacity, including the subset of pediatric hospital capacity, which we are not currently in danger of exceeding, we also believe strongly in the value of in-person education. And we know that our county health departments are taking the steps necessary to ensure that in-person education can continue, including steps like mask wearing, making sure that there's targeted quarantines, and hopefully increasingly large-scale testing.
Univision, you were next. Go ahead.
Hello, Governor. Jesús Carrasquel from Noticias Univision Colorado. ¿Podría decirnos cuáles son las estrategias que está realizando para evitar más contagios del COVID-19 y si usted obligará a todos los residentes del estado a colocarse la vacuna?
La estrategia más efectiva para evitar más contagios del COVID-19 es que más personas en nuestro estado se vacunen. También que utilicen un tapabocas cuando están en lugares cerrados con otra gente. Felicitó y aplaudió a todos los negocios y agencias locales que nos están ayudando a gente para recibir vacunas efectivo, gratis, y nada es más importante que recibir el vacuna en proteger su vida.
Ed, you are next. Go ahead, Ed.
Thank you, Governor. We're starting to see a number of conventions and events canceling here in the Denver area, and I suspect other areas of the state. Are you looking at all at putting any kind of restrictions on indoor events? Or on the other hand, are you looking to try to convince people it is still safe to bring their events out to Colorado?
Well, we're certainly one of the safest states, and if people are weighing holding events in Georgia or Florida or Texas or versus Colorado, we are one of the lowest states for COVID-19 rates in the bottom 10. So I would hope that people are considering moving important meetings to Colorado from Florida and Texas and other higher risk areas. And of course, we encourage all conferences to be able to take the steps necessary to implement best practices with regard to COVID-19. Those often include supporting indoor mask wearing. At times they include testing. At times they include vaccination requirements. There's a variety of ways to do it, but Colorado is looking like a better and better place to do business relative to Texas and Florida every day.
John Daly, go ahead. Go ahead, John.
Hi, Governor. Question about dashboards with local school districts. Some have dashboards up that the parents can look to see what the numbers might look like in their school system, but some aren't. What is the state doing to ensure that there are dashboards that folks can see in their local schools? And what do you think about parents trying to navigate that if it's hard for them to even know what's going on within their own school?
We're fully supportive of transparency, including all the additional convenient ways that districts make it possible for parents to check on the safety of their kids. Statewide, we have required reporting of COVID outbreaks. And those are defined by CDPHE. They're reported to county health. They're made public by county health. But I realize that there's a demand for more information than that. And the state is willing to work with every partner, including county health partners and school districts, to go above and beyond in meeting the information needs of parents.
Charles, you're up next. Go ahead, Charles.
Charles? Are you with us, Charles?
Oh, there it is. I thought they were going to unmute me. Sorry.
Go ahead.
Since I'm no longer exclusively on the COVID beat or on the general politics beat, but the Tina Peters beat, I wondered what you thought about what's happening out here in Mesa County with our clerk and the election equipment, and whether it's time for people such as yourself to call for her to resign.
Well, look, nothing is more important than voter integrity and in the ability to have unbiased, fair elections. Colorado is really the gold standard of safe and secure voting, no matter your party affiliation, no matter your beliefs. Each person's ability to cast their ballot is really a cornerstone of our republic. And I trust that the Secretary of State and the commissioners are taking this with the seriousness that it deserves to make sure that we can fully restore the public trust in the election process in Mesa County.
John Weiner, go ahead, John.
Yeah, Governor, this is John from KKTV in Colorado Springs. We're seeing continued and increasing questions about the safety with children in schools and the hospital capacities for children specifically. Like, at what point will you consider stepping in with more stringent state guidance, and is just simply leaving it up to the schools a strong leadership stance?
Well, we have adopted the CDC guidance, including mask wearing and ventilation and tests and health screening as our state guidance. We fully rely, of course, on the implementation of the school district and the county level. As I indicated, we look at a daily basis on both pediatric as well as overall hospital capacity. Neither one is in jeopardy right now. Every Coloradan who gets sick can get the very best quality of care, whether it's appendicitis, whether it's a heart attack, whether it's COVID, or whether it's pneumonia. They will get that very best quality of care that allows them to get better. And we continue to monitor that on a daily basis and know that our school districts across the state are taking this with the seriousness that it deserves to be able to prevent the overwhelming of our health capacity.
Sarah, it's your turn. Go ahead, Sarah.
Governor Polis, Sarah Flower with KSUT Four Corners Public Radio. Going on the heels of John's question there, here in Southwest Colorado, we have no pediatric hospital. We have no pediatric ICU beds in this region to use as a metric of how hospitals are doing. Our nearest is in Albuquerque, New Mexico, and we only have one district in the region that is mandating masks here. What advice do you have for parents that are concerned for the care of their children during this time as schools are opening their doors for in-person learning?
Yeah, we look at the ability to transfer severe pediatric cases where they're needed in our state. The spread of pediatric beds is different than the overall beds. Our state also serves large parts of New Mexico as well as Wyoming with regard to pediatric cases, and that's also taken into account with a number of beds that meet that capacity. The bottom line is we want to do everything that we can to make sure that every child and every adult that needs care for any reason in our state gets that very best quality of care they need. And that often includes closely working with the hospital system to make sure that patients can get that care at the best place for them, given their needs and their health needs and their geography.
And this will be our last question from a member of the media. Seth Klayman, go ahead, Seth.
Thanks, Seth at the Gazette. So, Governor, piggybacking on John Daly's question, so is the state tracking how many students and staff are in quarantine? I heard you say that you're tracking infections, but are you tracking that metric as well? And the state, you've said that the state can step in depending if districts are not instituting guidance and thus are being moved to virtual learning. Can you explain that a little bit more, what that means, the state stepping in? Thanks.
Well, we want to protect in-person learning. I believe that there's great value in kids attending school with their peers, with their teacher. We all know that that's even better when kids don't have to wear masks. But if the price of being able to stay in person is kids wearing masks for now, I think most parents want to make sure first and foremost that their schools remain in person. So there are some school districts that without mask requirements that are able to stay in person, but if they lose that ability over time and they go online, I think it's time for a serious conversation to say you can't just go online and not have in-person classes simply because you're not implementing mask wearing. Thank you all very much. And again, the cases in Colorado continue to be at a very high level, one of the lowest among the states, but keep in mind that America is one of the highest in the world infection levels now. So please be careful, wear a mask around others. And if you haven't been vaccinated, please get it done. It's quick, it's easy, and it's effective for everybody age 12 and up. Third doses for those who are experiencing a weakened immune system or immunocompromised. Thank you.
Recording stop.